What's going on, world? Welcome. Hey, y'all. Today is Friday. Yay! Friday, y'all. Friday. Hold on, I'm trying to get my life together. Trying to plug this phone in though, because I don't need this thing dying on me. What's up, everybody? How we doing? Hey, we're gonna be doing NCLEX questions today. Y'all already know how we do on this Friday. Congratulations to all of my individuals that took the NCLEX. Everybody that is graduating, right? Graduation. So shout out to all y'all. You already know we're going to be doing NCLEX questions. Hey, I need for y'all to like. I need for y'all to share. I need for y'all to follow. I need all three of those. I need 1,000 likes. I need 100 people in here. If I don't get either one of those, we're not going nowhere. Try me if you want to. All right. Hey, if you guys are new here, my name is Kevin. I'm a registered nurse. I've been one for almost 4 years. I have a BSN if that really matters to you. I have worked ICU, OR, and PACU, as well as I was in the Navy for 16 and a half years. The last 9 years of my 16 years was as a master instructor. So I bring the talents here to the good old TikTok. So shout out to you. Hi, I'm getting your program soon. Fabiola, ma'am, go ahead and get it. Hey, right now it's 70% off. And I'm working on about 40 or 50 videos that are getting recorded that are going to be uploaded there soon. So, hey, once you get it forever. You know what I'm saying? But of course, I want to know who you are, where you're from, where you're at in your nursing journey. All right. I want to know who you are, where you're from, where you're at in your nursing journey. All right. Let me know. Hey, I need 1,000 likes. I need 100 folks up in here. We need both. B-O-O. No, that's booth. B-O-F-E. B-O-A-F. Both. All right, we need them. We needs them. I saw that's a crazy special. I'm from Philly. I study for the NCLEX for my second time. That's what I'm talking about. Fabiola, that's what I'm talking about. Hey, you're delayed, never denied. All right, delayed, never denied. I passed my NCLEX on the 4th try. Yay. What is it? Is it Yipsy? Ma'am, congratulations. Shout out to you. I'm going to pin your stuff right now because, hey, we're all about giving nothing but love and support. I know all 41 of y'all right now while y'all are smashing that like button. I need for y'all to congratulate Whipsy, man, once again, congratulations. Welcome to the greatest shit show on earth, known as being a nurse. If there's a piece of advice that you could give to everybody, what would it be? And once again, congratulations to you. Oh my God. Did I just join in late? No, we just started. I need 100 people in here and I need 1,000 likes. Y'all know how I do. Y'all think I'm playing? Think I'm playing games with y'all? You know what I'm saying? Hey, Slytherin gang. Y'all already know what's up. Y'all know the deal. All right, what are we doing? It says Florida studying for NCLEX, just graduated. Shout out to you. Whipsy, you're welcome. Studying patho. Shout out to you. Hi from Zambia. Hi from Texas. Hey, Sahara's in the building. Hey, we got 100 people. I need 1,000 likes. We're almost there. Take my NCLEX on Tuesday. That's all right. You got it. You've been preparing. All right. You're a smart and talented individual. And I know that you've been preparing correctly. Hey, that's why we have these lives. That's why we do these things. All right. Shout out to Detroit. Shout out to you. Is it Dragon Fruit? All right. North Carolina just passed nursing school. Sarah, shout out to you, Sarah. Congratulations on getting through. Rebecca Whitaker just said, I found out I passed my NCLEX today. Ma'am. Hey, shout out to you. Let me go ahead and screenshot that. Hey, shout out to you, Rebecca. Congratulations on passing your NCLEX. Welcome to the greatest shit show on earth, known as being a nurse. If there's a piece of advice that you could give, ma'am, what would it be? What would it be? And once again, congratulations to you. Hey, we're about to do these questions. I appreciate everybody being here. So let us get started. All right, here we go. Question number 1. Nurse John is caring for a client in the outpatient clinic. Which of the following phone calls should the nurse return first? All right. So who should I call first? I listened to your lives and they helped so much. Rebecca, I'm so glad that the lives and everything helped you. All right. If there's a piece of advice, man, what would it be? Is it the client with hepatitis who states my arms and legs are itching? A client with a cast on the right leg who states I have a funny feeling in my right leg? A client with osteomyelitis of the spine who states I am so nauseous that I can't eat? Or is it a client with rheumatoid arthritis who states I'm having trouble sleeping? What do we think it is? Hey, if you guys are just now joining, we are doing NCLEX questions. These are both for registered nurses and licensed practical nurses. All right, registered nurses and licensed practical nurses, those that are going to be taking the NCLEX. All right, I need for you guys to smash that like button. Hey, we're on the road to 10,000 likes. Y'all know the deal. If I don't get 10,000 likes by the time I get to question 10, y'all are going to have a problem, not me. I'm just saying, y'all going to have a problem. So what are we thinking? Also, I want to know who you are, where you're from, and where you're at in your nursing journey. But everybody's screaming B at me. All right, well, let's see. What's up, Hannah? I see you in the building. Hannah's in the building, y'all. Justine, thank you for the follow. And the answer is Dots thinking C. Well, the answer indeed is B. It is B. All right. It says be confident in what you have worked so hard on. You know it. Don't overthink it. Love to hear that, Rebecca. Thank you for giving all that advice to all those individuals that are going to be taking that NCLEX come soon. All right. But the answer is B. A client with a cast on the right leg who states, I'm having a funny feeling in my right leg. This indicates neurovascular compromise. So it just requires immediate assessment. That is management of care, which is the largest section on NCLEX at 18 to 21%. LPNs. Yours largest section is coordinating care, all right, which is 18 to 24%. Still the largest section. All right, still the largest section for you on your exam. Gracie says, I'm from New Jersey. I'm about to graduate with my undergrad degree. Shout out to you, Gracie. Congratulations. All right, from Kentucky, nurse grad. I'm a double test taker. That's okay. There's no need for the sad faces up in here. All right, turn that frown upside down. Put in the work, see what you didn't do well on your first exam from that performance, that candidate performance report, all right? And then you improve upon it. That's how we do, all right? Question number 2. Nurse Sarah is caring for a client on the surgical floor and has just received a report from the previous shift. Which of the following clients should the nurse see first? So there's a pattern that's being set here, all right? Sounds like management of care type of questions to me, okay? So is it A, a 35-year-old admitted 3 hours ago with a gunshot wound who has a 1.5 centimeter area of dark drainage noted on the dressing, a 43-year-old who had a mastectomy 2 days ago and has 23 mLs of serosanguinous fluid noted in the Jackson Pratt drain, a 59-year-old with a collapsed lung due to an accident, no drainage noted on in the previous 8 hours, or a 62-year-old who had an abdominal perineal resection 3 days ago, complaints of chills. What do we think it is? Now think about that. Think about that. Who do I want to see first? Who do I want to see first? Who's going to die if I don't see them first? Everybody's telling me C. What's up, Samantha? I see you out there. Julia's in the building, y'all. Julia's in the building. Shout out to her. All right, what do we think it is? Some C's, some D's, some C's and some D's. Well, let's see. I see you, Julia. All right, here we go. Here's our answer in 3, 2. The answer is D, a 62-year-old who had an abdominal perineal resection 3 days ago, but is complaining of chills, all right? This patient is at risk for peritonitis, right? And should be assessed for further symptoms and infection. That patient is part of management of care, which is the largest section. Yes, chills are indicative of a fever. A fever is indicative of a possible infection, all right? So that's how you have to understand the critical thinking aspect, the critical thinking in order for you to make a safe clinical judgment, all right? Hemorrhage isn't urgent. So what stated that that patient had a hemorrhage, all right? A patient that hemorrhages is talking about more than 200 mLs an hour, all right? And that patient had 23 mLs. So think about that, all right? Think about that. Eden, is it Eden? All right. Management of care, largest section on the NCLEX for RNs, PNs. It's coordinated care. All right. Still same concept. All right. So here we go. Question number 3. Nurse Eve is caring for a client who had thyroidectomy, 12 hours ago for treatment of Graves' disease. The nurse would be most concerned if which of the following was observed. Is it a blood pressure 138/82, respiratory rate 16, temperature 99? A client supports his head and neck when turning his head to the right. The client spontaneously flexes his wrist when the blood pressure cuff is obtained, or the client is drowsy and complains of a sore throat. What are we thinking? Everybody's screaming C because of calcium risk. Bella, you so smart. Hey, shout out to all 200 plus y'all. We're doing NCLEX questions. We are on the road. We are on the road to 10,000 likes. I need for y'all to smash that like button. I need 10,000 likes and I need 100 shares. There's 200 of y'all, so I need y'all to share it to at least once. All right? Don't come over here and be greedy. You know what I'm saying? Give me some love. Give me some love. All right? And share it to Becky with the good hair. You know, you may not like her. I might, though. I might like her. You know what I'm saying? She may not be my type, but I might like her. You know what I'm saying? Oh, my God. Amos is here. Famous Amos in the building, y'all. Famous Amos. All right, now let's see. Let us see what the question, let's see what the answer is. Let us see what the answer is in 3, 2. And the answer is C. The client spontaneously flexes his wrist when the blood pressure is obtained. A carpal spasm indicates hypocalcemia. What's another name for that? Famous, who's that? Jod the Bid? Bid. I'm just going to call you Bid. Or Jay. Yeah, you're famous Amos. You heard what I said. Trousseau's, right? Travis? You mean Trousseau's? I got you, though. Yes, Trousseau's. There you go. So on NCLEX, it may not say Trousseau's. All right, but we have to understand what is the definition of Trousseau's, and it is the spontaneous flexion of the wrist, right? All right, autocorrect. Now you're good. All right, here we go. Question number 4. Julius is admitted with complaints of severe pain in the lower right quadrant of the abdomen. All right, to assist with pain relief, the nurse should take which of the following actions? All right, which of the following actions? Encourage the client to change positions frequently in bed, administer Demerol 50 milligrams IM Q4 hours and PRN, apply warmth to the abdomen with a heating pad, or use comfort measures and pillows to position the client. What are we thinking? Oh, I thought you said something else. My fault. No, Amos. 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 But that other word is that's also her. So it's all good. Shout out to almost 300 of y'all. Shout out to y'all. Hey, I want to know who you are, where you're from, where you're at in your nursing journey. All right. If you guys are just joining, my name is Kevin. I've been a registered nurse for almost 4 years. All right. I worked ICU, OR, and PACU. I was in the Navy for 16 years. And I've been teaching for almost 10 years, so shout out to y'all. Just graduated. Mocha, shout out to you. Least invasive. Okay. Least invasive. Okay. All right. Severe pain, like 9 to 10-ish. Okay. So those are those key words, right? Celebrating 32 years this year. Scott, 32 years as a nurse. Shout out to you. Shout out to you. Shonda, RN student. Man, I love y'all. You know what I'm saying? Dallas, Texas. Hey, shout out to all my Texans out here. I live in Texas too. LPN for 4 years. All right. Well, the answer is D. Use comfort measures and pillows to position the client. Using comfort measures and pillows to position the client is a non-pharmacological method of pain relief. So we always want to start out non-pharmacological, right? What can we do to help the patient without giving them medications? Remember, when we take care of patients, it's about patient first. What things can we do to not give them medications first? All right. So think about that. Physiological adaptation, which is the third largest section on the NCLEX exam. Third largest section on the NCLEX exam at 11 to 17%. You're like, I don't like this question. It don't matter if you like it. Hey, remember, NCLEX is perfect world. Hey, Nurse Cass is in the building, y'all. She's corrections nurse and she will fight you. I'm just saying. Caramel Candy just said New York, just trying to pass NCLEX. Hey, you gonna get there. You're going to get there. All right, here with question number 5. Nurse Tina Belcher, right? Prepares a client for peritoneal dialysis. Which of the following actions should the nurse take first? So what is the very first thing that we should do with a client who is having a peritoneal dialysis? Remember, sometimes you can reword these. You can reword them. All right, you most definitely can reword them. All right, do I want to assess for a brewery and a thrill? Do I want to warm the diacylate solution? Do I want to position the client on the left side or insert a Foley catheter? It's peritoneal, people. It cannot be A. Hey, so remember, ladies and gentlemen, everybody that comes into the chat, they're at a different level when it comes to their education. Okay. Some people don't know. Some people in here are not even preparing for NCLEX. They're still in nursing school, so they don't know necessarily. Right. So make sure you RTFQ. Ladies and gentlemen, for my frequent flyers, what does RTFQ mean? What does RTFQ mean? Okay. So for hemodialysis, who just said that? Hemodialysis, what are you checking for? Right. But hemodialysis and peritoneal dialysis, two different things. All right. Read the F in question. Y'all know what? Yeah. Y'all know what it is. Read the F in question. Eden, sure. If you want to say full, that's fine. I'm cool with that. All right. But the answer is B, warm the diacylate. Who said I just got my ATT? Who said I got my ATT? Megan? Megan, you got your AT? Oh, you're waiting on your ATT. Okay, shout out to you. All right, here we go. Cool diacylate increases discomfort. The solution would be to warm to body temperature in a warmer or heating pad. Do not use the microwave. All right, listen. Physiological adaptation. Now, the best way to use diacylate, they're talking about using body temperature. You can use the patient's body temperature. Never put it in the microwave. I'm telling you right now, I've literally seen people put it in the microwave. Don't you ever in your life do that. Ever. All right. Physiological adaptation, 11 to 17%. All right. 11 to 17%, making it the third largest section on the NCLEX exam. Hey, by the way, I got some test taking tips over there on my website called thebootnurse.com/test. I want y'all to go over there and go get that freebie, okay? It used to be one of my ebooks. I'm giving away for free. It's 42 pages. You get everything minus my fanny pack. And you get some pictures of this nice melanated gentleman right here. But go over there and get it, all right? Tips to conquer the NCLEX for y'all that are about to graduate, or even if you don't graduate for like another 6 months, all right? Go over there and get it, because who knows how long it's going to be there, you know what I'm saying? So make sure you guys go over there and check that out. By the way, I got these questions off nurseslabs.com. They are for registered nurses and LPNs, all right? They are for registered nurses and LPNs. You guys can go over there and you guys can check those out for yourself, okay? They are free. Set your questions. Free, Free, okay? So here we go. Question number 6. Nurse Jana teaches an elderly client with right-sided weakness on how to use a cane. Which of the following behaviors, if demonstrated by the client to the nurse, indicates that the teaching was effective? All right, so the answer that we're looking for is, did the patient perform the teaching and tasks correctly? All right, so is it correct that the client holds the cane on his right, or with his right hand, moves the cane forward, followed by the right leg, and then moves his left leg? The client holds the cane with his right hand, moves the cane forward, followed by his left leg, and then moves the right leg. The client holds the cane with his left hand, moves the cane forward, followed by his right leg, and then moves the left leg? Or is it that the client holds the cane with his left hand, moves the cane forward, followed by his left leg, and then moves the right leg? What are we thinking? What are we thinking? Still think A? Hey, you can still, here's a great thing about this train. Here's a good thing about when we go live, right? Is that even if you get it wrong, which a lot of you will start to get stuff wrong, all right? A lot of you would still get stuff wrong. This will tell you where you need to go and look back and get content. All right? This is where you would go to get back content if you were having what we call a content deficit. All right? If you were having a content deficit. All right? Shelby's telling me definitely C. Definitely C. All right? Well, let's see what the answer is. It says cane, opposite, affected leg. So I think D. Okay. I've been a nurse for 18 years and I still get it wrong. And that's okay if you get it wrong. Because guess what? You're going to get it wrong. And if you get it wrong, that's okay. It's okay. All right. So the answer is C. The client holds the cane on his left hand, moves the cane forward, followed by the right leg, and then moves the left leg. All right. The cane acts as a support and aids in weight bearing for the weak right leg. All right. Part of health promotion and maintenance, 6 to 12% on the NCLEX. Listen, nurseslabs.com, they have questions, but some of their questions don't go very much into depth with regards to the rationales. All right. And that's okay. My man said Cole. Yeah, cane, opposite, effective leg. Exactly. All right. So if you got it wrong, circle back and understand crutches, canes, and walkers. All right. Crutches, canes, and walkers. All right. Here we go. Question number 7. All right. Question number 7. An elderly client is admitted to the nursing home setting. The client is occasionally confused and her gait is often unsteady. Which of the following actions, if taken by the nurse, is most appropriate? Most appropriate. All right. Is it ask the woman's family to provide personal items such as photos or mementos? Select a room with a bed by the door so the woman can look down the hall. Suggest the woman eat her meals in her room with her roommate, or encourage the woman to ambulate in the halls twice a day. What are we thinking? A. All right. So we're talking about an elderly patient, right, who is occasionally confused and her gait is unsteady. So what is the main thing that we think about with our elderly patients that are confused, who have a balance issue? This is how you have to break down. This is how you definitely have to break it down. Okay. Thinking about a dementia patient. We're thinking about safety. We're thinking about being a fall risk. Absolutely. 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 All right. And that's how you have to break them down, regardless of whatever anybody's saying in here, saying about it being easy. Number 1, I didn't ask you if it was easy. Number 2, answer the question. Number 3, understand your critical thinking. You have no idea what an easy question is on NCLEX because you're only going to get a max of 150 when they have a whole bank of like over 10,000. All right. My gut says D, so I'm not changing it. Shelby, well, your gut was wrong. I'm just playing. That's okay, though. That's okay. So I want to ask the woman's family to provide personal items such as mementos, right? Because photos and mementos provide visual stimulation to reduce sensory deprivation, right? So what we want to do is we want to be able to redirect our patient, all right? Dementia patients, right? We want to be able to redirect them, right? So if I can redirect her back to mementos and photos, she's more likely to stay in her room if we're going to be doing specific things with them. Okay. Hey, don't cry. It's okay if you got it wrong, but understand why we got it wrong. All right. Physiological adaptation, third largest section on the NCLEX, right? 11 to 17%. All right. 11 to 17%. All right. Here we go. Question number 8. Nurse Evangeline teaches an elderly client how to use a standard aluminum walker. Which of the following behaviors, if demonstrated by the client, indicates that the nurse's teaching was effective? So what did the client use it correctly, right? Which statement shows that the client used this correctly? Does anyone want to know how long after graduation it takes the NCLEX? So Yari, I live in Texas. It usually takes anywhere from 2 to 4 weeks for you to get your authorization to test. Once you get your authorization to test, whatever the next available seat that's available, you can schedule it. All right, you can schedule it. All right, so is it A client slowly pushes the walker forward 12 inches, then takes small steps forward while leaning on the walker? The client lifts the walker, moves it forward 10 inches, and then takes several small steps forward. The client supports his weight on the walker while advancing it forward, then takes small steps while balancing on the walker. Or the client slides the walker 18 inches forward, then takes small steps while holding on to the walker for balance. You're welcome, Yari. What do we think the answer is? Hey, shout out to everybody that's out here rocking. Y'all got me to 10,000 likes. Hey, keep going. I need 100. Hey, I need 100 shares. I needs them. All right. If you guys are new here, we're doing NCLEX questions for PN and RNs. All right. A little bit about me. Been an RN for 4 years. Worked ICU, OR, PACU. Was in the Navy for 16 years. And I failed my NCLEX 3 times. And so your answer is B. All right. The client lifts the walker, moves it forward 10 inches, and then takes several steps forward. All right. So the walker needs to be picked up and placed down on all legs. So remember, before you do anything, you move one, set down, stabilize, and then you move. All right. Sit down, stabilize, and then move. Bye, peace. I'm leaving. Why? Why are you going? Where are you going? Where are you going? You can't go nowhere. You got to stay here. Ladies and gentlemen, I failed my NCLEX 3 times. All right. I failed my NCLEX 3 times, y'all. So there's a reason why y'all are here. If you're a first timer, cool. My repeat test takers, there's a reason why y'all are here. I failed 3 times. I passed on my 4th. Get out of your own way. Get out of your own way. All right. Hey, listen, y'all are smart individuals. There's a reason. Hey, listen, the hardest part about nursing is getting through nursing school. All right. Everything comes in levels. Everything comes in levels. And trust me when I tell you right now, no job is going to care. Your patient's not going to care. NCLEX is about nurse safety. NCLEX is about nurse safety. All right. And it's basic competence. And so you need to be able to understand the basic competencies in order to pass a safety exam. All right. So get out of your own way. It's okay if you failed. What is not okay is that you quit. And no, I don't like people that quit around me. All right. Because if you quit on me, you'll damn sure quit on your patient. I definitely don't want that around me either. All right. So get out of your own way. All right. So shout out to y'all. Here we go. Question number 9. Nurse Derek is supervising a group of elderly clients in a residential home setting. The nurse knows that the elderly are at greater risk of developing sensory deprivation for what reason? Is it increased sensitivity to side effects of meds, decreased visual, auditory, and gustatory abilities, isolation from their family and familiar surroundings, or decreased musculoskeletal function and mobility? What are we thinking? That's okay, Kevin. All you got to do is pass it once. Yep, that's it. It's just like you got to lift. Yep, there you go. Let alone drag on the carpet. I heard nursing school is tougher, but now I'm scared of NCLEX. Emma, don't be scared of NCLEX. Don't be scared of NCLEX. If you prepare for it, you're going to do just fine. I promise you. My guy again, look, you know what's up. All right. Shout out to all 126 y'all. We're doing NCLEX questions. All right. I want to know who you are, where you're from, and where you're at in your nursing journey if you're just now joining us. We got a bunch of B's and we got a bunch of D's. All right, let's see what the answer is. And the answer is B, as in Bravo, decreased visual, auditory, and gustatory abilities. All right, so gradual loss of sight, hearing, and taste interferes with normal functioning. That's 6 to 12% on the NCLEX exam. Like I said, nurseslabs.com. Some of them go really deep into their rationales and some of them don't. All right. So if this is one that you want more information on, then guess what? You got to go look it up. You got to go look it up. I'm a 4th-year nursing student from the Caribbean. Shout out to you. Essentially Monique. A shout out to you. Is it Cassandra? Just started nursing school. Shout out to you, Cassandra. Your journey has just begun. What's up, Chris? How are you? Miss Chris. It says start my bridge program on Wednesday. Is it Kia? Shout out to you. Shout out to you. Here we go. Question number 10. A male client with emphysema becomes restless and confused. What steps should Nurse Jasmine take next? All right, encourage the client to perform on pursed lip breathing, check the client's temperature, assess the client's potassium level, or increase the client's oxygen flow. What do we think it is? All right, now we have a client that has emphysema. Emphysema, 45 days from graduation. That's what I'm talking about. That's what I'm talking about. Go ahead and send me that invite so I can RSVP via TikTok, because that's the only way I'm getting there, right? So, all right, we got some A's and we got D. All right, we got a bunch of people kind of spread. It's about even, all right? It is about even. So this is where we got to understand what is emphysema. Like, what does it look like, pathologically, pathophysically, like what it says, it traps O2, okay? So how do we get O2 out? It says pink puffer, okay, COPD, hypoxia driven, so I'm thinking emphysema, barrel chest. It says client keep their SpO2 on the lower side. Okay, low O2 is baseline. Okay, A and then D. Okay, I changed to A. Okay, well, let's see. Let us see what the answer is, right? And the answer is A. Encourage the client to use pursed lip breathing, right? So pursed lip breathing prevents the collapse of the lung unit and helps the client to control the rate and depth of breathing, right? So you want to be able to push out that air, right? You want to be able to push that out. It says, I'm taking my NCLEX, taking my fourth and on the 28th, and I graduated in 2005. Chris, ma'am, you already know what's up. You know what's up. I'm proud of you because you keep going, right? Always keep going. All right. Remember, everybody's journey is different. And I can't wait for you to tell your story when you finally conquer that exam. All right. Destination is still the same. Destination is still the same. All right. Ladies and gentlemen, once again, hey, go over there. If you're new here, go over there and get you some test taking tips. All right. Go get them. It's 42 pages. Like, listen, it's overkill. It's absolutely overkill. And it was one of my ebooks before, and now it's not. I just gave it away for free. All right. Why? Because I love y'all. You know what I'm saying? I want y'all to do great out here. All right. I want y'all to do great out here. So make sure you guys check that out. thebootnurse.com/test. All right. Oh, by the way, happy early Mother's Day to all my mothers out there. Happy early Mother's Day. That's on Sunday. So happy early Mother's Day to all the moms out there. Shout out to Ghana. I see you. Is it Eddie? I see you. Here we go. Question number 11. Eddie has undergone a kidney transplant. What assessment would prompt Nurse Katrina to suspect organ rejection? Is it sudden weight loss, polyuria, hypertension, or is it shock? It says, can you zoom out a little? Let's see. How's that? Is that better? D. Okay, everybody's telling me D. Let's think about that. Everybody's telling me D. Some people are telling me C. Okay. Shock, most dangerous. Kinda. All right. Let's see. Let us see what the answer is. And the answer is C. Hypertension, along with fever and tenderness over the graft kidney, reflects acute rejection. All right. It says C because you would be holding fluids. There you go. You would be holding fluids. Absolutely, with hypertension. Okay, I was wrong. That's okay. Hey, listen, it's okay if you got it wrong. That's okay if you got it wrong. This is why we're here. This is why we're learning it. All right. So that is part of reduction of risk potential, 9 to 15% on the NCLEX exam, 9 to 15%, making it the fourth largest section on the NCLEX. All right. LPNs, you got to know the same content. The same content. All right. You have to know the same content. All right. So shout out to everybody that got that right. Hey, we're on the road to 20,000 likes. I'm at question 12. If y'all want, listen to me. If y'all want more questions, y'all got to stop being greedy. You know what I'm saying? I don't care if you're doing dishes. Take your wet, soapy ass hand and start smashing that like button. Okay. Here we go. Question 12. The immediate objective of nursing care for an overweight, mildly hypertensive male who with ureteral colic and hematuria is to decrease what? Pain, weight, hematuria, or hypertension. It says, If you pass HESI, like PASS, what are your chances of passing NCLEX? I personally don't like HESI. I used HESI when I was in school. Me personally, I didn't feel like HESI prepared me for NCLEX at all. Now, with that being said, if you're a person who does really well or who has been doing really well on those exams, like I think that based off of those, are they helpful? Yeah, but I would rather use something else. That's me though. And I did, because HESI did not help me at all when I took NCLEX, period. But I don't say that to scare you. I say that to be just completely real. So, all right, y'all, let us see what the answer is. And the answer indeed is pain. All right, it's pain. So sharp, severe pain or renal colic, right, radiating towards the genitalia and thigh is caused by urethral distension and smooth muscle spasms. Relief from pain is the priority. All right, that's actually part of physiological adaptation, which is the third largest section on the NCLEX exam. Third largest section on the NCLEX exam at 11 to 17%, right? Yeah, Cassandra says, yes, exactly. Pain is a vital sign. Indeed it is. Indeed, because, hey, when you do your assessment, hey, are you in any pain right now? What's your pain level at? See what I'm saying? Don't forget about that. Do not forget about that. All right. I don't understand how it's scored or why it's scored that way. And that makes sense. That makes me so mad. I wish I could tell you, because when I took those HESIs, I did not do well on them. I didn't do well on them just because the simple fact of their questions, like a lot of the times the questions didn't make sense to me, and the instructors the ones that I had were terrible. So they're just like, hey, figure it out. And I'm just like, how do we figure this out? Like, you guys are here to help us. And then a lot of them were pretty worthless. So here we go. Question 13. Matilda with hyperthyroidism is to receive Lugol's iodine solution before a subtotal thyroidectomy is performed. The nurse is aware that this medication is given to Kiki, graduated. Shout out to you, Miss Ma'am. Congratulations on graduation. Congratulations. Hey, one step closer to getting that NCLEX, all right? Is it to decrease the total basal metabolic rate, maintain the function of the parathyroid glands, block the formation of thyroxine by the thyroid gland, or decrease the size and vascularity of the thyroid gland? I'll say D. Okay, cool. All right, let's think about that. Now let's think about it. Hyperthyroidism. That means that what is it doing? What is the thyroid doing? Is it not producing enough, or is it producing too much? Think about that. Break it down. Producing too much. Okay. So let's think about that. So if it's producing too much of a thyroid hormone, right? What would we want to do? Do we want to think about it? It's producing too much. There are words that are in the answers that are helping you, such as decrease and block. Would we want to maintain it? So think about those things. All right. Or block. It could be block, right? Let's see what the answer is. This is how, when you break the questions down, y'all, this is how it is. Hold on one second. I don't know what's going on here. All right, here we go. And the answer is to decrease the size and vascularity of the thyroid gland. All right, so Lugol's solution provides iodine, which aids in decreasing the vascularity of the thyroid gland, which limits the risk of hemorrhage, right, when surgery is performed. Well, dang. And that's the thing. It's like when we understand, I have no idea like why this thing keeps happening right here. So that's okay. I just want to make sure that this is big enough so you guys can see it. All right. It says no, but we learn from our mistake. Exactly. You have to learn. Like if you get it wrong, that's okay. I want you to get it wrong. That way you can understand why you got it wrong, so you don't get it wrong later in the future. Okay. Pharmacological and parenteral therapies, which is the second largest section on NCLEX at 13 to 19%. 13 to 19%. Okay. It says, so I'm going to go need this. Yeah. Savage Mama, keep studying. Always. Hey, you keep studying all the way up until the day before your exam. Or not the day before, but the day before your exam. All right. So question 14, Ricardo was diagnosed with type 1 diabetes. The nurse is aware that acute hypoglycemia also can develop in the client who is diagnosed with what? liver disease, hypertension, type 2 diabetes, or hyperthyroidism. Nurse Cece's in the building, y'all. Nurse C is in the building. Anybody that ever needs help with dosage calculations, all right, the dosage calculations queen is in the building, and she runs that kingdom, all right? So if you guys ever have a problem with regards to med math, that is your lady. She will get you hooked up. Also, she posted a video today talking about how Ascension Seton, which is one of these big hospitals out here, they had a cyber attack and they had to do paper charting. So guess what? There was no computer to give you med math numbers. All right. There was no computer to give you med math numbers. So what does that tell you? Your ass is doing some dosage calculations on some paper. That's how important it is. All right. So if y'all want to get brushed up on your med math, that is your lady to go talk to. All right. But the answer indeed is A. She's like, child, we was back in the Stone Age. I just pinned her. All right. So y'all go follow her. All right. By the way, she's working on a workbook. All right. That workbook's coming out soon. So y'all go follow her so y'all know when that thing coming out. All right. So a client with liver disease has a decreased ability to metabolize carbohydrates because of the decreased ability to form glycogen, right? And to form glucose from glycogen. That's part of physiological adaptation, which is the third largest section on the NCLEX exam. Third largest section on the NCLEX exam at 11 to 17%. All right, 11 to 17%. So if you didn't get it right, circle back, get these answers right. By the way, when you guys are reading your rationales, you guys need to RTFR. What does it mean? Who can tell me, my frequent flyers? What does RTFR mean? Let me know. Let me know. All right. Here we go. Question number 15, Tracy, is receiving combination chemotherapy for treatment of metastatic carcinoma. Nurse Ruby should monitor the client for the systemic side effect of ascites, nystagmus, leukopenia, or polycythemia. What are we? So RTFQ means read the effing question, but what does RTFR mean, Savage Mama? Let me know. Hey, if you guys are just now joining, welcome. We are doing NCLEX questions for both RNs and LPNs. I need for you guys to smash that like button. I need for you guys to share. Hey, we need 100 shares, and I need 20,000 likes. I need 100 shares. There you go. Read the effing rationale. Yes. Yes, Lord. That's how we do around here. That's how we do around here. Everybody's screaming C. There you go. Bria knows what's up. Y'all know what's up. Hey, I see these frequent flyers that happen up in here, all right? Happy Nurses Week to all my nurses that are out there. By the way, it's almost over. Sunday is over, all right? And the answer indeed is leukopenia, all right? So leukopenia, a reduction in white blood cells, is a systematic side effect of chemotherapy as a result of myelosuppression, all right? Physiological adaptation. Third largest section on the NCLEX exam, all right? The third largest section on the NCLEX exam at 11 to 17%. All right, 11 to 17%. I got these questions off nurseslabs.com. They are free sets of questions. You guys can go over there and check those out for yourself. Once again, ladies and gentlemen, test taking tips. If you're new here, if you haven't gotten them, go get them. And if you, hey, send it to somebody else. Let them know. Send it. Hey, if you're in nursing school, go over there and get that. You know what I'm saying? Go over there and get that. That's 42 pages of buttery, delicious goodness. Minus the fanny pack. You know what I'm saying? Go get a fanny pack. $6 at Walmart. Stop playing games with me. All right, here we go. Question 16. Norma, with recent colostomy, expresses concern about the ability to control the passage of gas. Nurse Oliver, shout out to Oliver, should suggest that the client plan to what? Eliminate foods that are high in cellulose, decrease fluid intake at mealtimes, avoid foods that in the past cause flatus, or adhere to a bland diet prior to social events. Maritza, how are you? Good evening to you on this Friday, as they call it. Friday. All right. Kiki's telling me C. We guys, all right, cool. All right. Hey, if you guys are just now joining, welcome. I want to know who you are, where you're from, and where you're at in your nursing journey. And if you're not a nurse, what are you doing here hanging out with us? What are you doing? All right, we got Clem is telling me A. May is telling me C. Key is telling me, everybody's telling me C. All right. And we got one that's saying A. Well, let us see what the answer is. All right, here's our answer. New York and graduating on the 21st. Sabrina, that's what I'm talking about. That's what I'm talking about. Almost there. Here we go. And the answer is C. I want to avoid foods that in the past caused flatus. Right? Hey, so what foods can cause you gassiness? What foods? Name them out. All right, so foods that bother a person preoperatively will continue to do so after the colostomy. Health promotion and maintenance, 6 to 12% on the NCLEX exam. Broccoli is a big one. Beans, green leafy vegetables, but broccoli is a big one. Broccoli is a big one. All right, or like kale, right? Exactly. Broccoli. There we go. Garlic. All right, here we go. Shout out to y'all. So those are the type of, listen, you gotta, it doesn't matter how easy you may feel these questions are. Think about in your mind, you're like, man, I would have asked that question a lot differently. Spicy foods, that actually is irritating. That's irritating to colostomies, right? To the stomas, right? Because the spicy foods to be tearing the GI tract up. So you're going to have lots of irritation on the stoma. So spicy foods is more of an irritant, not of a flatus, right? But definitely something you do want to avoid when you have a colostomy, right? Or you have a colostomy bag or anything like that. Nurse Ron begins to teach a male client about how to perform colostomy irrigation. The nurse would evaluate that the instructions were understood when the client said, I should lie on my left side when instilling the irrigation solution. I should keep the irrigating container less than 18 inches above the stoma. I should instill a minimum of 1,200 mLs of irrigation solution to stimulate the evacuation of the bowel, or I should insert the irrigating catheter deeper into the stoma if cramping occurs during the procedure. What are we thinking? A's? A. Shout out to all 79 of y'all out here rocking. We're doing NCLEX questions. I need for y'all to smash that like button. Hey, we're almost at 20,000 likes. Get me to 20,000 likes. Stop playing games. Make it happen. Who else is graduating up in here that hasn't told me? Who else passed NCLEX in here? It says, what was the website again? The website for what? Will and Allison. I graduated today. No, you didn't, Amos. No, you did not. No, you didn't. Why are you always coming in here fibbing? But you don't even care? Stop it. You're right, I don't. I'll just play it. I graduated in 12 days. Is it Kathleen? Shout out to you, Kathleen. See, Kathleen came in here telling me the truth. Amos be coming up in here lying through her Amos. See what I did there? All right, but it's B. Keep the irrigating solution at least 18 inches above the stoma. This height permits the solution to flow slowly, right? While little force, so that excessive peristalsis. Oh my God. Peristalsis. Oh, listen, messing up. I'll be messing up right now. All right. It's not immediately, precipitated. Health promotions and maintenance. Dang, I learned something new today. Listen, we do learn stuff new today. We learn new things every day. And I learn how to spell and how to pronounce words every day because I'm slow. All right. Health promotions and maintenance, 6 to 12% on the NCLEX exam. 6 to 12% on the NCLEX exam. All right. Here we go. Question number 18. Patrick is in the oliguric phase of acute tubular necrosis and is experiencing fluid and electrolyte imbalances. The client is somehow or somewhat confused and complains of nausea and muscle weakness. As part of the prescribed therapy to correct this electrolyte imbalance, the nurse would expect to what? Administer K-Exolate, right? Administer K-Exolate, restrict foods high in protein, increase oral intake of cheese and milk, or administer large amounts of normal saline via IV. What are we thinking? Does the ATT expire? Your ATT will expire a year from when it was authorized if you haven't used it. Yari, what part of Texas do you live? I mean, it doesn't really matter, I guess, but what part of Texas do you live in? Shout out to everybody that's in Texas. I live in San Antonio, so shout out to all my Texans out there. Like I said, I want to know who y'all are, where you're from, and where you are at in your nursing journey. What are we doing? West Texas, probably like what, Midland, Odessa, going towards El Paso? All right, what are we thinking? All right, here we go. And the answer is A. I want to administer K-Exolate. Just graduated a few months ago. So you live in El Paso? What's really crazy? I like El Paso, just driving through it, not staying though. K-Exolate is a potassium exchange resin, right? Permits sodium to be exchanged for potassium in the intestines, reducing the serum potassium level. All right. Listen, K-Exolate pushes potassium out through the gastrointestinal system, right? K-Exolate, right? If you don't know what K-Xlate is or lactulose or those types of meds, I highly recommend you. I highly recommend you to look those up because those are very not only highly testable items, but highly given medications in the hospital. All right. Physiological adaptation, 11 to 17% on the NCLEX exam. All right. 11 to 17% on the NCLEX exam. All right. So shout out to each and every one of y'all. If you got it wrong, that's okay. Circle back and make sure we RTFR. Okay. Here we go. Question number 19. Mario has a burn injury. All right. After 48 hours, the physician orders for Mario 2 liters of IV fluid to be administered Q12 hours. The drop factor of the tubing is 10 drops per ml. The nurse should set the flow to provide what? Is it 18, 28, 32, or 36 drops per minute? What are we thinking? Shout out to all 76 of y'all. We are doing NCLEX questions. We are doing NCLEX questions. These are both for RNs and LPNs, all right? From nurseslabs.com, free sets of questions. You guys can go over there and check those out for yourself. You guys can also go over to my website and get yourself a free download, thebootnurse.com. Go over there and get you a free download. Stop playing games. All right. I'm updating another one, and it's gonna be about, those top meds, top medications to be on the lookout for, right? When it comes to taking the NCLEX. I'm not finna do all that math, but D and A, or you mean which one? It's either D or it's A. All right. All right, let us see what the answer is. Got B. Okay, well, let's see what the answer is. And the answer indeed is B. It is 28 drops per minute. This is the correct flow rate. So you want to multiply the amount to be infused, which is 2,000 mLs, right, by the drop factor, which is 10, and divide the result by the amount of time in minutes. So 12 hours times 60, because there's 60 minutes in 1 hour. Okay, and that's what gives you your 28 drops per minute. Pharmacological and parenteral therapies. I feel you, Eric. Eric got the right idea, right? Eric got the right idea. All right, so pharmacological and parenteral therapy, 11 to 17% on the NCLEX, making it the third largest section on the NCLEX exam. Damn, I forgot to convert to mLs. Hey, listen, if y'all have a hard time doing dosage calculation, y'all need to go follow Nurse C, a blessed RN. If you type in the search, a blessed RN, she does dosage calculation. That is her thing. All right. And she does them every Wednesday and Sunday. And she is thorough when she goes through it. All right. That is her bread and butter. So if y'all want to learn in depth about it, she will get you right. All right. Here we go. Question number 20. Man, we're at 20 and I only got 15,000 likes. Well, I guess this is all y'all get for the rest of the day then. Here we go. Question 20. Terrence suffers from burn injury using the rule of 9, which has the largest percent of burns. All right. Is it the face and neck? Is it the right upper arm and penis? Is it the right thigh and penis? Or is it the upper trunk? So out of all of those, what section is the largest? D. Oh, okay. D. All right. Cool. All right. Let's see. We say C, the right thigh. Now think about the rule of 9s. Everybody remember what the rule of 9s looks like, right? With the little mannequins. And it tells you based off of what body part, what percentage is burned. All right. And Mon says it's 36%. The trunk is 36%. Yeah, because think about it. It's 36%, right? Because 18 for the whole, 18 for the front and then 18 for the back. The thigh, 9 on each side, so 18 for the whole leg, for the whole thigh, or the whole leg, I should say, right? So here we go. So the answer indeed is D, is the upper trunk, okay? The percentage designated for each burn part of the body using the rule of 9s. The head and neck, 9%. Upper extremity, right? Right upper extremity, 9%. Left upper extremity, 9%. Anterior trunk and posterior trunk are both 18, equaling 36. And then you have your left leg being 18, whole leg, and then your right leg being 18, whole, or left and right legs. Both are 18 total. So 9 in front, 9 in the back, right? And then your perineum. So vagina, penile area, right? 1%. Physiological adaptation, which is 11 to 17% on the NCLEX exam. All right. 11 to 17% on the NCLEX exam. Remember, y'all, Like you got to know those things. All right. You got to know those things. Ladies and gentlemen, hey, I have a book coming out on June 5th. That June 5th is actually my anniversary date of me becoming a nurse. So that'll be my 4-year mark. And I have a book. It's called Conquer It. It's a published book. And not only a published book, I'm an award-winning author. Like, look, see that stamp right there? That's real. Certified. Put a stamp on it, right? And this book was created to help motivate nursing students and nursing graduates and anybody that's going to be on this journey to become a nurse, to let you know it's okay. It's okay for you to fail. It's okay for you to be unsuccessful at trying to not only conquer this exam, but anything that you're doing in life with regards to nursing, all right? And it's okay. It's okay for you to be unsuccessful, but it is never okay for you to quit, ever. Because I'm telling you right now, if you quit on a test, or you quit on yourself, you'll quit for somebody else. Remember, y'all, I'm a military guy. We don't quit for the person that's left or to the right of us, right? Because in the end, I want to make sure that they get home. And in the end, I want to make sure that y'all understand this. And if I have ever done anything for you, ever, like if it's been the course or if it's been these lives, I would love for you guys to support me, all right? So you guys can go over there and check it out. You can pre-order it right now, okay? And it's going for $14 if you get the Kindle version, and then $25 or $24.99 if you get the paperback version. And I'm also going to be doing a live book launch on TikTok when that comes as well. So if you guys want to pre-order it, you guys can get it right there at thebootnurse.com/books. All right. And of course, make sure you guys go over there and get your free download. All right. Go get that free download. Stop playing games with me. All right. Go get it. Go get it for yourself. All right. And then lastly, hey, I was on a podcast called Nursing Uncensored, and the jurisprudence, no, it's not hard. And I was on a podcast on Nursing Uncensored. We talk about toxicity and critical care. I talk about NCLEX prep and helping y'all and building a community online with y'all, because that is what I love to do. I just got the free download. Looks good, Kev. I'm glad you like it. All right. So listen, this is me telling y'all about my journey. All right. And guess what? Your journey will differ. You may have a better time, but I can tell you right now, there's a lot of times I did not have a good time, and I talked about that, all right? But I want everyone to learn from my experience, because a lot of people won't be honest. They'll be like, oh, no, you'll be fine. No. There's a big difference of being fine and people just telling you to figure it out and get over it, because we don't do that around here. We have to bring each other up, not push each other down, all right? So make sure you guys go check it out. The Nursing Uncensored podcast. You can find it on Spotify, all over the place, okay? Make sure you guys go check that out. And of course, ladies and gentlemen, hey, that wraps up the questions today. When it comes to NCLEX questions, hey, I wanted 20,000 likes and I didn't get it. So that's all right. But y'all got 20 good old questions. So shout out to y'all. All right. So, hey, I appreciate everybody participating. Thank you for the gifts. Even though they're not required or mandatory, they are surely very much appreciated. If you got banned, you deserved it. I didn't ban anybody. I don't think I had any mods ban anybody either. So shout out to y'all. Hey, once again, I got these questions off nurseslabs.com. They are free sets of questions. Nurseslabs.com, free sets of questions. Go over there and check them out for yourself. Like I said, Nursing Uncensored podcast. That link is in my bio. All right, it'll take you directly there. Hey, I have an NCLEX course right now. It's 70% off. 70% off, and you get lifetime access to this course. I have 80 videos in there. I have 2 NCLEX reviews that are in there. The link is in my bio, and yes, it works for LPNs as well. If you're one of those people that have failed multiple times, you don't know where to start, you don't have accountability, you don't understand NCLEX style questions or how to apply content to questions, you need help with a schedule, you need help with your time management, you need some mentorship. I do that too. You guys can check that out. That is also linked in my bio, NCLEX coaching and mentoring. All right. So, but with that being said, what's up, y'all? How y'all doing? Hey, if you guys don't follow me on Instagram, what are you really doing? I posted a really good picture over there. It's called Award-Winning Author. As a matter of fact, I'm going to see if I can put it on here. What's up, y'all? Shout out to all 52 of y'all. Appreciate y'all rocking with me. My name's Kevin. Of course, see the aura, the gray hair. Listen, look. You see that right there? That's nursing, deployment, a divorce, you name it. All that shit's up there, right? So I want to know who you are, where you're from, where you're at in your nursing journey. I've been a nurse for, like I said, almost 4 years, BSN, RN, if the RN aspect really matters to you. Thank you for the hat, Kiko Suave. I appreciate you. And like I said, I was in the Navy for 16 years. I actually just got out this past January. and 9 years was as a master instructor. I failed my NCLEX 3 times. Three. And I don't care about what anyone has to say about that, right? Because that's my journey. That's mine, right? So someone else is in here saying like, hey, I failed it. That's okay if you failed it. It's all right if you failed it. Like, don't you ever care about what somebody says about you when they have never walked a day in your shoes. Ever. That's just like me trying to take advice on how to become a billionaire from somebody who is not a billionaire. You see what I'm saying? There's levels to this. There is levels to this. Okay, I failed a couple times, and that's cool. No, you did not say go Saints, ma'am. First of all, you know better. I'm about to block you. No, I'm just playing. Who said thank you for your service? Kiko Suave, I appreciate your support. Appreciate it. If I don't pass my NCLEX tomorrow, I'm going to need your help. Hey, you visibly see me. I am right here. I am very much a real person. All right. So no, first of all, I want you to change your verbiage. Don't you tell me that. Don't you tell me if I don't pass. You will speak it into existence right now, but you have to believe it. I cannot want you to pass your NCLEX more than you do. I can speak on it. I can pray about it. I can do whatever. But you have to believe your own words. Not only do you have to believe your own words, you have to truly believe that you put in the work for it. All right. What happens is in nursing school, they tell you that you're this horrible fucking person if you don't pass NCLEX the first time. That's not true. It's not true at all. It's not true. The exam doesn't determine what type of nurse that you are. Only you do. Once you get this license, now the real fun begins. All right. Now, what are you going to go and do with it? Are you going to go out there and not learn? Or are you going to be a shitbag? Were you a shitbag before and now you're going to be a shitbag now? Like what are you doing? All right. Only you can determine that. And guess what? Not one person is going to ask. And then 4 years later, you're going to be like, yeah, I failed 4 times. People will be like, oh, what? I would have never guessed, because it doesn't matter. It doesn't matter. It doesn't matter. All right. I'm so scared to take the NCLEX. Mom, boy of 3. Same thing goes for you. Don't be scared of an exam that you can take multiple times. Don't be scared of an exam that has no emotional ties towards you whatsoever. All right. You're welcome. It says, yep. It says, you're so encouraging. Thank you. You're welcome, Yari. Hey, Yari, I don't know if you're new here. I think you're new here, but I do this all the time. You know, I do this Monday, Wednesday, Friday, 5:30 Central Standard Time. Not you, because you're on Mountain Time if you're in El Paso. So that's weird. That's weird. Right? But yeah, I'm all about the encouragement. It says, do you record these? I do record these. So you can actually go to my YouTube channel, which is The Boot Nurse, and all of these recordings eventually will get uploaded there. They'll also be getting uploaded to my website as well. So make sure you guys check out my website. Make sure you guys check out and go follow me on YouTube. Okay. It says, thanks, I feel better now. You should feel better. Like, I usually have my performance breakdowns and I show them. I always show them. I'm like, it said, look, me, and I talk about myself. I'm like, I'm slow, below slow, right? Here I am. Here I am, a boot nurse, established in 2020, right? So like, it's okay. It is okay that you were unsuccessful at that exam. It's okay. However, it is never okay for you to quit. Ever. Yes, definitely, by tuning in more. Hey, I love it. I love it. I love it. It's Friday. It is Friday. It's Friday. You love the shirt. Hey, if you go to my website, it'll take you there. It'll take you there. Hey, have you ever heard of Concord? I have heard of Concord. Are you talking about like trying to go to school there? If you go talk to my constituent, which is Night Nurse 305 TV. I need all 35 of y'all to go over there to Night Nurse 305 TV. I need for y'all to go follow her, Nurse Larissa. She will literally give you the inside scoop on how she feels about Concord, Fortis, Brown Mackie, all these other places that are like that. I think Concord's been around for quite some time. But I really don't know the ins and outs aspects of Concord. So I don't I don't want to lie to you like that, you know what I'm saying? Or give you false information. But one thing I will say is to continue to do your due diligence. Continue to do your due diligence with regards to what program you go to. Make sure that they're accredited, right? That they're not like under investigation by the Board of Nursing. Look at their NCLEX pass rate. What else they got going on? Look on like how often They put on classes, right? And depending on what state that you're in, depending on how can you apply. So I know like California is really big on doing like lotteries, right? So what do you need to do for that lottery? How do you need to make your application for nursing school more competitive? Do you need to do volunteer work? Do you need to, do you want to work as a patient care tech while you're in LVN school? All these other things. So think about that. Shout out to everybody that's just joining. Hey, you guys missed us doing NCLEX questions. Is it Jessie J, like the singer? Oh man, I think she left. Anyways, like I was saying, those are the things key that you need to be looking out for. All right. But if you guys just now joining, like I said, we were doing NCLEX questions. Now we're doing Ask a Nurse. You know what I'm saying? So whatever question you guys have, I'm gonna hang out for a little bit. Today is Friday. You know what I'm saying? So what questions do you guys have? Whoopsie. What questions do you guys have with regards to nurse, like getting into nursing school, HESI, ATI, NCLEX, that's my specialty. Your first year as a nurse, imposter syndrome, whatever question. It says, yeah, working as a CNA, and yeah, thanks. Yeah, absolutely. How long do you recommend studying for NCLEX after graduation? Yari, you should be studying for NCLEX all the way up until, and I think I said that, you should be studying for NCLEX all the way up until the day before your exam. So if your NCLEX is Monday, your last day that you should be studying should be tomorrow, right? And you want to take if you just now graduated, or after graduation, you want to take your NCLEX as soon as possible. Yes, you want to schedule. As soon as you get that authorization to test, you get on the next thing that's smoking. That's exact. The reason being is because the longer that you're out of school, the longer you're out of school, all that data in your head that you learn from school is going to start to just flow away because you're not going to be thinking about it. You're not going to be in school mode. I take my prereqs in September, but I love watching and learning on your lives. Reese, is it Reese? Reese, baby. I'm glad that these lives are helping you. All right. Keep doing your prereqs. All right. Make sure you follow me, but also follow Larissa, which is Night Nurse RN or Night Nurse 305 TV. Also follow Nurse C to get your dosage calculations because you're going to be there. Right. And also follow Nurse Glamber, aka Nurse Amber, who's my A1 since day one, who also does NCLEX. Okay. Candace just came in and said, I passed NCLEX. Ooh. Hey, you already know what to do. Candace, ma'am. Congratulations to you. Welcome to the greatest shit show on earth, known as being a nurse, either RN or LPN. LPNs, you are nurses, all right? Licensed practical nurses. It says it right there. Y'all better stop playing games with me, all right? So, ma'am, Candace, if there's a piece of advice that you could give to anybody out here or any and everybody out here, ma'am, what would it be? And once again, congratulations to you. And now that you're a nurse, happy Nurses Week to you. Happy Nurses Week. Hey, nursing students, all right, and nursing graduates, not yet. Nurses Week is for nurses. Y'all aren't there yet. That ain't no disrespect. That's just what it is. All right. But y'all are going to eventually be a part of that. All right. CD girl, I see you. All right. It says, I definitely will. Thank you. Awesome. It says, should I do a lot of practice questions? So I would recommend, because you're a repeat test taker, doing a lot of questions doesn't necessarily help, right? You need to have a good understanding of content so you can apply that content to critical thinking aspects of questions. That's what you need. So you could actually end up doing, like a lot of people say, hey, if you do 4,000 questions, you'll be good to go. I mean, you could actually do a quarter of those, like 1,000 questions or 1,100 questions and still get the same result because you're getting quality versus quantity, right? A lot of questions doesn't mean that it's necessarily good for you. Right. When I studied for NCLEX on my last go round, I was probably anywhere between 11 and 1,300 questions. Right. Other people was like, oh, I studied 2,500. Cool. That didn't work for me because I took my time. OK. So that may be something that you want to do for yourself. Hey, what's going on, everybody? My name is Kevin. I'm a registered nurse. We just got finished doing NCLEX questions. All right. So what questions do you guys have? Hey, who wants to come up and ask me a question? I know a lot of people were asking. They're just like, hey, can I come up and ask you a question? If you want to come up, just let me know. And then maybe we could do like a little exchange. So dang, I missed it. You did. Dee Dee, you missed it. You did miss it. Yeah, for sure. So, but yeah, what questions do you guys have? It says Archer Review and ATI book really helped me. So here's one of a few people that says ATI helped them, right? So ATI can work. Just like someone else was asking about HESI does work for those individuals. For me, it didn't. ATI worked for her. A lot of people say they don't like Archer because it didn't work for them. It may not work for you, but it works for other people because the proof is in the numbers. Candace used Archer Review. It worked for her. She studied 6 hours a day, took a break on the weekends. Look at that. So she had a schedule for herself. She knew what she was studying, and she remained committed to it. So you used UWorld. So you used UWorld. How did that feel? Why did you? I used UWorld. So how do you feel about it? So UWorld didn't work for you. So now for you, switch it up. Go to something else. Go to Kaplan or go to Archer for their questions, right? Go to Kaplan for their questions. You want a review that you have forever? Come to me. Go check it out. You get it. Hey, you have it forever. All right. So make sure you check that out. It says, or you used Hearst. So here's the thing, Amos, is I tried to use Hearst and I was so distracted by everything that was going on. Like, I don't know why. And I had an older version of Hearst before it got updated. And one thing I can say about it is that it works for people. And I got distracted by using Hearst because honestly, it's her accent. It's actually a lot of the people's accent. I think her niece is in there as well. She's like, hey, y'all. Kind of like Nurse Sarah. She that accent is thick to where I'm just like, I can't unhear that, right? So it may work for you, right? If Hearst is working for you, it works. So 2 people that I've coached in the past, they used Hearst and UWorld at the same time. And it worked for them and they passed, right? Other people have used Archer. Other people have used Kaplan. Other people have used like all these other things, It didn't work for me. It's true, the accent. Yeah, that's what I'm saying. So you understand what I'm saying. You understand what I'm saying for sure when I talk about like, with teaching, we call that an environmental distraction. It's not her fault that she has an accent. You know what I'm saying? But it's a turnoff. I didn't realize that that's the kind of party that we were in, but whatever. She from Mississippi, y'all. So don't be talking about Aunt Marlene like that. She been out here doing her thing for quite some time. It says what is a quim? I don't even know what that is. I feel like that's a derogatory term. And if you say it to me again, I'm going to ban you. You understand me? I'm going to ban you. No, but what's up? Shout out to y'all. Is it, you know what I mean? Yeah. Oh, know what I mean. Oh, so why didn't you just say that? I'm not hip to what that one is. Now, if I would have waited, I would have Googled it and be like, oh, okay. So when you say it the next time, I would have been like, all right, cool. What is a quim? We so lazy we can't write shit out? My God. Hey, shout out to y'all for joining. It says it's longer. Come on, man. Listen, you call me old man? God damn. You're right. I'm old as shit. But that's all good, though. That's all good. But welcome to everybody who is just now joining. We did NCLEX questions. My name's Kevin. I'm a registered nurse, and we're doing a Q&A. So whatever questions you guys have about nursing, about NCLEX, about getting into nursing school, getting through nursing school, like there are so many different ways to approach nursing school to be successful through it. All right. Morris says, hey, Kevin, can one failed one nursing class 2 times and still get accepted to the same school? So Morris, I'm not sure about that. That depends on the school. So if you failed one class and then they dropped you and then they let you back in and then you failed another class, it's totally up to that school if they want to let you back in, right? It's at their discretion. Now, what I can tell you is that if they don't let you back in, will that stop you from going to another program? No. There's one young lady I was coaching who failed out of one nursing school, applied at another nursing school, and then graduated. But then she ended up failing her exam, I think, like 3 or 4 times. And when I coached her through it, she did her thing. So hopefully that answers your question. Shout out to all 23 of y'all. What other questions do you guys have? What other questions do you all have? I should turn on some music. Got to go. Talk to you later. Bye. Have a good weekend. And I will see everybody on Monday. Or I'll see you on Monday, I guess. If that's what I was really looking forward to. You know what I'm saying? Oh, you know those? Yep. I know those. So what other questions you guys got? Hey, if y'all don't got no questions for me, you know what I'm saying? Who is that? Gracie, welcome in. If you guys are just now joining, we're doing NCLEX questions. Hey, there's a couple things that happened today. They actually had a rally, I think, in Ohio talking about safe nursing practices, right? They were at the Capitol building. Okay, so I'm a huge advocate for safe nursing ratios. Let me tell you something right now for all y'all that are in here. There, you have no badge of honor by saying how many how many patients you can hold by yourself. There's no honor in that. All you're going to do is number one, you're going to burn yourself out. Number two, it's unsafe for you and it's unsafe for the patients. All right. So don't feel like you have to wear a badge of honor with regards to, yeah, I took 7 patients and they only took 4. And then, like there's nothing cool about that. I've had people say, yeah, I've taken 9 patients before. I was just like, why would you ever do that? They were like, oh, because I could. And I was like, that's the dumbest shit I've ever heard somebody say. Why would you do that to yourself? Or do that, better yet, do it to the patients because it's unsafe. And then, you got people that are actually put in those positions, unfortunately, and you're spread thin, and then they're all over the unit, So what's up, Naz? It says invite Naz. I don't want to invite Naz up here. What's up, Naz? Naz in the building, y'all. Naz is my other Naz, what are you? My other mod, and I'm a nursing student. Naz, did you take your test yet? What's up, K.A.? Medicate's in the building. Miss, I want to go be a PA instead of being a nurse practitioner because I don't know what I want to do. No, I'm just playing. Shout out to Kate. Kate's a paramedic, about to go to PA school, do her thing. I'm proud of you, Kate. Anybody interested in the paramedic route to go PA for whatever reason, make sure you guys go holla at Kate. She will get you right. Rescheduled it for August 1st. Man, what are you doing? What are you doing with your life? Stop postponing. You're denying the inevitable, all right? So what's up, everybody? Hey, I'm gonna hang out. Woo, Lord of mercy. I'm gonna hang out for a little bit. I'm hanging out for a little bit to let me just fix that. There we go. I'm gonna hang out for a little bit to see, like what questions do you guys have? What questions do you guys have about nursing, about NCLEX, about, I don't know, my fanny pack, whatever. What we got? What we got? Nothing? Nothing? Man. So nobody wants to come up? Like usually I got a bunch of people that want to ask me questions. And then when I'm like, hey, do you guys want to come up? They're just like, no. I'm just like, all right, cool, whatever. I'm also my last semester of nursing school. GPA is a 3.8. Give me a break. First of all, oh, you think you're cool, Naz, because you got a 3.8? Oh, look at me. I'm just playing. Let me stop. Hey, a 3.8 in nursing school. Shout out to you. Nerd. I love that, though. I love that. How's your EKG course going? So I put my EKG interpretation lecture inside of the 7-day NCLEX course, and it's gotten a lot of good feedback. A lot of people like it. They like it for sure. Do you think 3 to 4 weeks of studying is enough time for NCLEX? So Zay, that's kind of a weighted question. So first question I'm going to ask you is it your first time taking the exam? If it is, you should have been studying like right before you graduated. That's what I would say. Number one. Number two, if you're a repeat test taker, you should be studying. If you're a repeat test taker, you should be studying for at least 30 days, no longer than 90 days. All right. But a good happy median is the 30 to 45 day mark. All right. But it all just depends on you. Like what you're learning, what's your learning ability, right? Or what's your learning style, right? What's your environment look like? Do you have a problem with NCLEX style questions? Do you understand content? Do you have a problem, conveying them both, right? You said every day you're studying. So let me ask you about not the consistency, but the quality of your studying. Okay. So are you studying to the point to where, like you say that you're going to do something, let's say, oh, I'm going to do 85 questions, but do you do your 85 questions, right? Do you do them in parts where, yeah, I'm going to do 20 questions here, 20 questions there? I don't like that because it doesn't allow consistency, right? I would rather you sit and build up endurance for an 85 question quiz or an 85 question whatever than you sit here and do 10 questions here and do another 20 questions there. Like give yourself some consistency, right? Do you have break days? Do you do content? What content do you start with? What content what content gives you the worst, gives you the biggest headache that you have the most trouble with, right? Is it pharmacology? Is it peds? Is it psych? You know what I'm saying? Vara, what's up? How are you? Think about those things. All right. And so do I think 3 to 4 weeks is enough time? It all depends on where you are individually. Okay. So short answer, yes, but it depends on you. Naz, what are you crying for? What'd I do? Did I say something wrong? I didn't mean it. What's up? Shout out to all 13 of y'all. Vera, thank you for the likes. I appreciate you. Hey, I was gonna give more questions, but nobody wanted to give me more likes. So I had like another like 15 questions. But Zay says good insight. I appreciate that. I'll have to reflect on that today. Hey, reflect on it. Reflect. Like what does Tony Baker say? He was like, sit back and reflect. Right? So I wanted to show, that's what I wanted to show y'all. I'm about to show y'all what if I can find it, like what an award-winning, somebody told me like, what does an award-winning author look like? And I'm like, I don't know. Let me see if I can show you what an award-winning author looks like. I posted this on Instagram, right? Look at that, y'all. Boom. Look at that dude. Hey, that dude, look at that dude. Hey, look at that dude right there. Hey, that's me. That's me. That's me. You know what I'm saying? Yo, that's me. That's going on the back of my book, y'all. It's going on the back of my book. Crisp photo. That's what I'm talking about. You know what I'm saying? Hey, that's what I'm talking about. I like that picture. It looks good. So in my mind, I'm just like, you know what? I'm just going to keep that there. They're going to be like, who's that in your background, bitch? Me. Right. So, yeah, that's going to be on the back of my book, which is coming out in less than a month, y'all. It's coming out in less than a month. Okay. And, look, I can't wait. It says it's giving Kevin Hart, first of all. Sure. Whatever. He's older than me, so I guess we can say that, right? Kevin Hart. Hey, listen, if I start doing public speaking stuff, like I won't be able to help my personality because I've been like this my whole life. And so if I get up there and I end up, being a comedian, people are gonna be like, oh, he's a Kevin Hart, impersonator. I'm like, listen, I was like this before Kevin Hart, but whatever. And then when I found him, I was just like, or when, he started doing his thing, I was like, oops, I guess it kind of just worked out that way. So, but all right, y'all, what other questions do you guys have? We're just vibing. Thank you guys. I appreciate you guys' comments. And plus I had just got a haircut that day because look, I couldn't be taking no picture looking rough. You know what I'm saying? Couldn't be taking no picture looking rough. So, but what other questions do you guys have? Shout out to all 15 of y'all rocking. It says, I take my NCLEX in 2 weeks. Is it Katia Vanessa? Is that how I say it? Is it Katisha? Kat? Can I call you Vanessa? I'm just going to call you Nessa. Can I call you Nessa? I have a friend named Vanessa and I call her Nessa. But you take your NCLEX in 2 weeks. Shout out to you. So are you just now graduating, I'm assuming? Keep pushing. Keep pushing. Keep pushing. You graduate April 26th. So you graduated a few weeks ago, like 2 weeks ago, maybe, right? So congratulations to you on graduating. All right. So keep pushing and you take it in 2 weeks. So that puts you at it's like right at the beginning of June. No, did I do that right? That's 14, that's 24. No, yeah. So you right the 24th around that time. Right. So one thing I'd say is to keep the consistency, almost 1 month. Yeah. So keep the consistency of you studying. So if whatever way that you've been studying, keep studying that way. If it's working, if that studying method is working for you, stay that way. All right. Don't try to change it up, because when you try to change it up and you make a massive change, it can really mess with your flow. It says, I haven't taken a break. Okay. So take a break. It's okay for you to take a day off. Actually, I would really recommend that you take a day off. As a matter of fact, I'm about to give you a gem. You ready for it? Let me know when you're ready for it. Give me a heart. Give me an excited face. Give me something. I'm about to give you a gem. All right. Is it Souza? What's up? Hey, if you guys are just joining, hey, we're just talking. Yes, you're ready. All right, cool. So what day are you taking your NCLEX? And this is a gem for all 14 of y'all that are in here. And it's so simple. You're taking it May 22nd. What day is that? I can't look because my calendar. At 8 a.m. Okay. Let's see. What day? I need to know what day that is, calendar-wise. It's the 22nd, 7. That's a Wednesday. Okay. So here's what I'll recommend to you. Take your break days every Tuesday from now on. I mean, you only got a couple of weeks, like 2 weeks left, right? So on Tuesday, take a break. And then the following Tuesday, take another break. Or I'm sorry, take a break on Tuesday. And for anybody that's in here, for whatever day that you're taking your NCLEX, Monday through Friday, the day before needs to be your break day. That way you are already in the routine of having a day off before you go and you take your NCLEX, right? So me, when I was studying for NCLEX, I had 1 day off, no more than 2, right? Because take a day off before your NCLEX. And I say this is the reason it says, so do nothing at all. Yeah, so take a break. Take a break. Listen, if you've been studying for 6 days in a row, okay, and you're showing the consistent growth on your questions and on your answers, and you're still getting content and you're showing growth and you're showing sustainability. So if you're getting like 60, 65, 70s, and you're looking really, really good on your quizzes, if I tell you to take a day off, that 1 day should not destroy your entire efforts. Exactly. You need a self-care day. You need to take a break. So if your NCLEX is on a Wednesday, take Tuesdays off, right? So your NCLEX is down here. You're studying up here, right? So Wednesday, Thursday, Friday, Saturday, Sunday, Monday, work days, content, Q&A. Tuesday, off. Rinse and repeat. Tuesday, off. Rinse and repeat. Tuesday, off. The next day you take NCLEX. Now you have created the consistency of having an every Tuesday off and then taking a test or something like that the next day. Like you're already mentally in work mode, right? It says my tests or my scores keep going up, but I need more work. And that's okay. And that's where you show with the consistency. That's where you show with the consistency. All right. Does that make sense? Like that's not a drastic change. That's actually something that you would want to implement because you haven't had a day off. Right? There you go. So if that works for you, cool. And then when you pass, give me a testimony. All right. No, but that'll work out. That'll work out for you. It says, right, my brain is just tired. Exactly. So you have to give this muscle, you have to give it a break. All right. Because then there's going to be a point to where you're going to just be doing questions and doing content and you're not going to be able to retain it. All right. You're not going to be able to retain it mostly because you're burnt out. Like you've exhausted it. Give yourself some time. Relax. Go get your feet done, even though it costs $200 to do that. Or, go have brunch with the girls because apparently that's a thing, right? I don't know. I feel like maybe you have a dog, a little like Pomeranian or a Shih Tzu. Why do I feel like you have a frou-frou really ass dog? Take them out and let them go play at the park, at the dog park or whatever weirdness that people like to do with their dogs. All right. Go take some time to recalibrate for yourself. I literally scheduled my test Thursday and my anxiety stress levels have been so high. So this right here can help alleviate that. Your scores will start to help alleviate that. All right. Poodles. Oh my God. You have a poodle? You would have a poodle. You look like you would have a poodle. Yeah, I said what I said. All right. I said what I said. What did it say? Literally. Yep. So that will be my suggestion for you. All right. It says, hey, what does that even mean? I don't even know. Let me look at you, Naz. Let me look at you. Oh, Naz, you definitely have a poodle. Naz looks like she's on the bougie side, right? So she definitely has a small dog. And for the fact that she just said poodles, I know that you have a poodle. You look like you have a poodle. All right. It says, but I can't stop thinking about NCLEX. That's okay. You can't stop thinking about NCLEX because it's a big milestone that you're about to attack, right? And so by preparing for that, you will, the more that you prepare for it, the less the anxiety happens. All right. So every time that you take an NCLEX, create the testing environment. Create the testing environment for yourself. All right. That's how you beat the anxiety. That way, when you go and you take your exam, it's like a super test. Just think about it like, oh, it's just all it is just another day of me sitting in my room in front of my computer. Right. I even feel scared and emotional. Never felt like this even in nursing school. That's because this exam is an accumulation of all of your work from the moment you opened your mouth to the moment from the moment that you open your mouth to the day that you sit for that exam. I want to be a nurse. That could have been a 3-4 year journey. For me, it was 8. If you talk to my homie nurse Amber, it was 17 for her. Right. So I say that as in you become nervous because it's all this work that happened before you could get to sit for a 5-hour exam. And that's why you're nervous. And that's OK. It's a part of the process. Right. But what we don't want is we don't want our nervousness to take over and our anxiety to take over to allow us to be complacent when we're taking our exam. I know I'm going to start practice testing at 8 a.m. to mimic my time. Exactly. That's exactly what I want for you to do. It says, you got this, girl. Trust your skills, knowledge, and all the hard work you're putting. Exactly. You have to trust the process. All of this is part of the process. Every single one of it. Listen, the NCLEX results came out for the first quarter, 94% pass rate. Repeat test takers, I think it was at like 79% for the first quarter. So from January to March, January to March, the first quarter came out. Right. So with that being said, the chances they were pretty high. They're pretty high. All right. So, but you have to put the work in. If this test was easy, it would be 100% pass rate all the time, but it's not. However, people are preparing the correct way, and keep preparing and you'll be fine. You'll be just fine. All right. So, I mean, we all can't be 3.8 people like somebody, but whatever. You know what I'm saying? It says, I know I've heard a lot of people. You heard a lot of people pass. So here's the thing. I don't want you, not saying that I don't want you to celebrate other people. All right. Because we want to celebrate other people and their accomplishments. But don't let their accomplishments cloud you and your ability to take this exam. All right. Because remember, you're not them. You don't know what they did and you don't know how they study. All right. And so do not compare yourself to Becky with the good hair or whoever else. All right. Trust I haven't been working. There you go. I believe you. I believe that you've been working and putting in the work consistently. All right. And it's going to show. It shows on your practice tests. It shows with the increase of the scores. And then ultimately it's going to show when you pass that exam and you have a license. That's exactly what it's going to do. All right. Hey, SSH mentoring is in the building, y'all. That's my other mom, right? Sarah, I love you. All right. She is also an award-winning author. She's also an award-winning author to 3 books. And she is the one who has pushed me past a limit that I never thought I could do. So Sarah, I love you for that. If you guys ever need business, mentoring, entrepreneur, anything, that woman right there, let me tell you something right now. There's not a lot of people that will come into your life that'll change you drastically. And I'm telling you, that woman right there will do it for you. So Sarah, thank you so much. I love you for everything that you do. Thank you so much. I needed to hear this because I've been a mess. Look here, mess. I'm gonna start calling you mess. Mess-ness or messy Nessie. No, that sounds weird. I'm not gonna do that. But it's okay. It's okay. Listen, I've been where you've been. I failed my exam 3 times. I've taken it for the first time. I have been where you've been. Trust and believe. All right. Which is why I'm telling you right now that how you're feeling is very normal. It's okay. But if I could, get rid of all this nonsense that's out here to refocus you, to course correct and calibrate, that's what I'll do. And that's what I've been doing. I've been on TikTok for over a year. Giving back because that's what I do. That's what you're supposed to do. Because who's going to teach us other than us? Who's going to teach us other than us? Right? So I'm just saying, what other questions do you guys have? I'm going to hang out for another few minutes. See what y'all got going on. All right. Hey, if you guys are just now joining, we did NCLEX questions earlier. We did about 20 of them. We did about 20 of them. And now just answering questions like, oh, I missed them. Naz, of course you missed them. Of course you did. All right. But I mean, it's not like you don't know that I do them, mod, right? Any other tips for studying, preparing for my test on May 22nd? So a lot of things. Here's what I'll say. Make sure you recreate the testing center. That's a big one, right? So we know in the testing center that you will not, you're not allowed to have food, drinks. You're, understand that it's like going into a secure building. All right. It's like going into a secure building. So you have to the atmosphere is going to be a little different because there's cameras everywhere. There's protocols and procedures that they do. So you have to be prepared for that. All right. But then realize that you want to be able to recreate the testing center as much as possible so you can mirror it. It helps with your anxiety. So do that. No food, no drinks, no phone. Set a timer. Understand that, hey, you need to be answering these questions at a specific amount of time. You should not be spending 5 minutes on each question because you will run out of time. You get a max of 85, a minimum of 85, a max of 150. All right. A minimum of 85, a max of 150. Okay. You get 5 hours to take this exam. And it's on a running clock. So if you raise your hand because you got to go dookie or whatever, right, your time doesn't stop. It does not stop. Okay? It keeps going. It's on a running clock. So if you're gone for half an hour, best believe 30 minutes is ran off the clock and you can't get it back. What's up, Grace? Oh, Grace is in the building, y'all. Grace is in the building. One of the silent ones, but comes up every so often. So what's up, Grace? How are you? Right? So, definitely recreating the testing center. Make sure you build your endurance by doing your questions. Do at least 85. Why? Why would I tell you to do at least 85 questions? I don't know, because my enemy is going to give me at least 85 questions. You see what I'm saying? Those are the things that you got to look out for. Who just gave me something? We is love, send, let them cook. I appreciate you. Thank you. Thank you for letting me cook. You know what I'm saying? That's what we do all here. So, but what's up, Grace? What's up? Hey, you missed it. We did questions unless you were silently back there doing something. If you guys are just now joining, we did NCLEX questions for RNs and PNs. I got those questions off nurseslabs.com. You got their free sets of questions. You guys can go over there and check them out for yourself. And now you guys can just ask a nurse, like, what questions do you guys have? What other questions do you guys have? Vanessa, did that answer your question though? It says, I'm doing all right. Took my exam in April, didn't pass, took a break, got myself back to work. That's what I'm talking about. What exam? You took your NCLEX in April? Is that what we're talking about? I'm about to start studying again. And I get a lot of people that always ask me specifically. They was like, hey, I failed my NCLEX, 3 or 4 times. What should I do? I was like, you need a coach. I'm not telling you need a coach. I would highly recommend getting a mentor. Getting a mentor of some sort. You test on your birthday. So Vanessa, you want to know something funny? And this has nothing to do with you taking your test on a birthday, right? But I took my test on my birthday and my first exam that I took, and I failed it, right? But that was my fault. I didn't study the way that I should have studied. But, my birthday gift to myself was an NCLEX fail. And I'm like, well, hell. I actually talk about that on my first test failure inside of my book when it comes out. It's coming out in June 5th. So crazy. That's all they had. That's all right, though. It'll be one of the best birthday gifts that you'll ever give to yourself. Just came upon you a couple of weeks ago. It's so dope that you're doing this. Yeah. Is it Shy Moonstone? Look, I've been doing this for freaking, like I said, a year. I've been coaching NCLEX. I've been teaching myself NCLEX for the last 6 years, but I've been coaching NCLEX for the last 4. So yeah, I've been doing this for a while. So I love doing it. If I didn't like doing it, I wouldn't be doing it full time. And I do this full time now. Like, this is what I do full time, is teaching NCLEX. What did you say, Grace? It says, yes, my RN, getting my money up so I can have you as a tutor. Grace, come on. I got you. You already know what's up. I'm going to get you right. You better, hey, if y'all have seen any of those testimonies that I got, I get people right. Best believe that. All right. It says, do you know 100% an online bridge class for LPN to RN? I do not. Maybe I think Capella, maybe WGU, I think is another one. Maybe Grand Canyon University. I'm not sure, but I will go follow the lady. Her name is Night Nurse 305 TV, aka Nurse Larissa. She will be the one to tell you, and she will get you right. I promise you, she will get you right. Proud of you for this. Absolutely, I love doing this, and I'll keep doing it. All right. You tested on your birthday and failed? Yes, Vanessa, I tested on my birthday and I failed. However, that's my story. That's my story, not yours. All right. Do you also teach in person or host online seminars? So I have done a live NCLEX review. I have done a live NCLEX review online. I have not done one in person yet. I actually do plan on doing a live NCLEX review sometime this year, but that's a lot of work on my end. But it's not like I wouldn't be able to accomplish that. I just got to get some other logistical things done. But I have done an online one. I have done an online one. I heard Proc. I've heard WGU had good price. So WGU is based off of you, right? So like you pay in 6-month increments with WGU, right? Like I was looking at their master's program and I want to say it was like 6,000 every 6 months. So like you could literally I could get my entire degree done in 6 months if I wanted to and only pay $6,000, right? That's where they try to tell you like, hey, like it's crazy affordable. It's crazy affordable. All right. But who said that to me? What is love? I would definitely go follow the lady. I would definitely go follow the lady for sure. But you didn't know the prices. They tell you the prices on WGU. They'll tell you the prices. It says, I have a staffing agency. I want a study partner. I am from Ethiopia. So if you're looking for a study partner, are you talking about like for NCLEX specifically? If you're looking for a study partner, I mean, there's Facebook groups that are out there. I actually have a Facebook group, and you can Google that, or you can go on Facebook and you can type it in. It's the Boot Nation. You can check that one out. But then I also have another group where I do live NCLEX style questions and stuff like that. So that's also going to be open up and available to y'all, and that's going to be $10 for y'all to join. If y'all want to do that, it'll be $10 a month for you guys to join, because I go up in there and I'm in there and I'm super active. All right. It says getting off my beach. We'll definitely be reaching out soon. Much love. All right, Grace. Hey, look, I'll be waiting. Listen, when your name come across, I'm like, oh, I know that name. I know that name. So, hey, take your time, do your thing, and I'll be here. It's for my client. They want a mentor. So are they nursing? I'm assuming, right? So if it's nursing and they need help with NCLEX and they want a mentor, all they need to do is go to the link in my bio, and then you go into the link tree and it says where it says NCLEX coaching and mentoring. Boom, right there. And if that's something that they want, I have that available as well for everybody. Shout out to everybody that just now joined. We were doing NCLEX questions. Now we're just asking a nurse. So what questions do you guys have about asking a nurse, right? So talk about nursing school, talk about, getting into nursing school, all that stuff, right? Talk about NCLEX, talk about imposter syndrome, because that is a very real thing, and it is an ongoing issue that happens within nursing, not just nursing, but in any profession. So what questions do you guys have? I'm from Ethiopia too. Look at that. Boom. 2 folks connected right here inside the chat. All right. So what other questions do you guys have? I said I was going to hang out here. You guys started asking me questions and I got held hostage. So what questions do we got? Ali said, I just graduated a week ago studying for the NCLEX and I feel I know less than I did in school. Ali, because you do. I'm just kidding. I'm just messing, Ali. Don't go nowhere. Ali, it feels that way is because the way NCLEX is, they already expect for you to understand the content. So the way that the questions are asked, they require you to use your critical thinking. So essentially think about when you're in clinicals and when you're looking at the patient, you got to determine on what's happening based off of what we see, not only at the patient, but we also got to look at the monitor to see what's going on as well. If you guys are just joining, my name is Kevin. I've been a registered nurse for 4 years, BSN if you really care about that. I worked ICU, specifically in a burn ICU and a medical ICU. And then I worked PACU, and then I worked OR. I was in the Navy for 16 years, and I also failed my NCLEX 3 times. So to tell you the truth, Ali, it's okay, and that's normal for you to feel that way. So my recommendation for you is if you don't have a review, which you should, I recommend my review where I go through step by step, as well as get yourself a set of questions. So Archer, UWorld, right, and start practicing. So keep it fresh in your head. Thank you for let them cook. What is love? Got held hostage? Yeah, Naz, I stay getting held hostage. Come on now. What are we talking about? Jeez. Um, is it Shawaskia? Oh, did I say that right? Please tell me I said that right. Shawaskia. Shout out to you. You're doing Archer. Archer's good, Vanessa. Archer's good. Archer is good. Who just followed? Just Dell. I appreciate the follow. You did? Shawaskia? That's what I'm talking about. You know what I'm saying? W's in the chat for this dude figuring out words and names and stuff. You know what I'm saying? Hey, but what other, hey, hi, how are you? What's up? Is it Sweetie Akins? Or yeah, Akins? Shout out to you. All right. So what other questions do you guys have? We're talking about, we're in here, we're talking about nursing, trying to get into nursing school, the T's, the HESI, passing nursing school, NCLEX, that's my bread and butter. That's what I do. Trying to get that first job, you know what I'm saying? Other people that I would recommend that you follow, y'all let me know. What questions do y'all have? What questions do y'all have? Naz, who is one of my mods, she's holding me hostage up in here, telling me I can't go nowhere until I answer all these questions, which I'm like, all right, I guess, whatever, you know what I'm saying? Well, Naz, don't do that. Don't make those eyes at me, okay? Don't do that. Don't do that. Poodle lover. No, what's up? But what other questions do you guys have? What other questions do you guys have? Oh, and of course, if you're interested in this shirt, all you got to do is just go to my website. And then, the website clip, it says apparel, and it's available to you, so you can go get one. So, all right, I'm working on a whole bunch of other like apparel and stuff like that. But Ali, I know that I answered your question to the best of my abilities. Do you feel like that helped? Do you feel like that helped you? All right. Hey, if you guys are just joining, hey, by the way, we do NCLEX questions every Monday, Wednesday, Friday at 5:30 Central Standard Time. All right. Central Standard Time here in the USA, in the US of A. Okay. So just make sure make sure you follow me, turn the notification button on so you guys know when I'm going live. Also, we don't know what's going to happen with TikTok here in the US. So I would recommend everybody follow me on Instagram, which is linked in my bio as well. And follow me on YouTube, which is also linked in my bio. Thank you. Yes, definitely. Great. I'm glad that helped you out, Allie. How do you feel about going to nursing school straight out of high school? If you can go to nursing school straight out of high school, go do it. Go do it. The biggest thing is that you want to be able to prepare yourself. All right. Listen, I became a nurse later in life, in my 30s. I became a nurse, I think at 30. Wait, I'm about to be there 32-ish, 31 or 32, one of the two. I forgot. So if you come right out of high school and you get into a nursing program, let's say a 4-year, by the time you get out of nursing school, you'll be 22. That's about the average age of nurses is between like 22 and 25. Right, that's the bulk of nursing coming straight out of school. So you be about that average age, that average demographic to do that, for sure. I think it's okay. I think it's cool because guess what? By the time you're my age, like in your 30s, you're gonna have a decade and some change of all this nursing experience if you decide to stay a nurse. All right. How are you all studying for NCLEX? Drip EP. It all just depends. Everybody's a little bit different. So. Do you need content? Do you need questions and answers? Do you need a review? How is your study habits? Do you not understand content? Do you not understand NCLEX style questions or how to convey them? Because remember, NCLEX is not about memorization. NCLEX is about applying your content, using your critical thinking to make a safe nursing clinical judgment. That's what that's about. So you could use Archer for questions. You can use UWorld for questions. Those would be the two that I'd recommend. I have an NCLEX review. Right now it's going for $97. And you get it for a lifetime. So however long your life is, you get to have it. Or if you pass it down, ancestors be willing, they could use it too. You can check that out. That link is also in my bio. But it all just depends on you. Everybody studies differently. Also, figure out what type of learner that you are. Are you a read-write? Are you an auditory? Are you kinesthetic? Are you visual? Are you a combination of both? 70% of people that study for NCLEX, 70% of people are visual learners. 70%. So you see it and you're just like, oh, okay, how can I mimic that? And then you mimic it, right? How many hours are good to study a day? Vanessa, I would say if you want just a blanket answer, probably anywhere between 4 to 6 hours a day. All right. But it has to be good quality studying. You can't go study, 20 minutes here and then do another 20 minutes there and then do 30 minutes here. Like you need to find the time for it to be consistent. All right. Oh, I missed it today. Brown sugar. Honey. You missed it. All right. Belle, what's up? What's the deal? It says we need oversized sweaters for different specialties. Naz, what do you mean? What do you mean you need oversized sweaters? What are we talking about? You're all for LPN study as well? Yes, Charlie, it's for LPNs as well. We need, I said, I have to move from knowledge-based memorization to clinical application. Yes. Listen, there's a pyramid. There's a pyramid when it comes to what the questions, what they want, right? I know that you know that a normal blood pressure is 120 over 80. I know that you know that hypertension is 140 over 90. I know that you know that. That's a memorization type of question. All right. But I need for you to recognize that what happens, which is this is where we recognize cues. What happens if I give you this vital sign, but then I also give you this other issue? And I also give you this other issue. Can you recognize that these issues, this triangle of issues, what would it represent? Right? And you need to be able to and it represents from pathophysiology. So if I start talking about polyuria, polydipsia, and polyphagia, right? What does that represent? Diabetes. What does DKA represent? Dehydration, a high potassium, right? What else could it represent? Fruity breath, right? Acetone breath, right? And then what are my clinical implications? Like, what do I do? How do I fix this patient? Is that patient chronic? Do I want them to live with DKA? No. Do I want to fix them? How do I fix them? Are they acute? You know what I'm saying? Are they stable? Are they unstable? That's what you have. That is what the clinical application is. You applying all of the knowledge so you can make a safe clinical judgment. Okay. Hopefully that makes sense. It's about understanding. It is about understanding. It's not about understanding. Because you have memorization and you have the understanding aspect, right? Remembering, understanding, but it's about applying. That's the biggest thing. Please no bully me today. Bell, ain't nobody bullying you. Stop it. Ain't nobody gonna bully you. Bell, I haven't seen you in a long time, so I really don't want to bully you. And I don't bully you anyway. Stop it. People in the chat gonna think I'm crazy. Didn't you say you're working on some apparel? Ma'am, Naz, I am working on apparel, but I am one person. I am one person. Ali says, I'm nodding in agreement and understanding on the side of the screen. I got you. That's exactly what we want. Does any dental clinic ask you to advertise for your teeth? They're very beautiful. They don't. They don't ask me to. Should I do that? First of all, I appreciate the compliment. Second, no dental clinic has asked me to advertise with my teeth. I would do that. Hey, listen, this was braces. Let me tell you, braces hooked it up, right? So, hey, first of all, did no one saw my book picture, right? Nobody saw my book. First of all, I'm really proud of that picture, okay? And I'm gonna show y'all, and y'all are gonna like it. Y'all are gonna like every bit of that book picture, all right? I'm gonna show it to you right now, all right? Because if you like those teeth, baby, look at those. Look at those teeth right there. You know what I'm saying? That's me, y'all. That's me. That's me right there. That's going on the back of my book, y'all. That's going on the back of my book. If you guys want to pre-order my first ever published book, go check it out. It's linked in my bio. All right. I'm going to take that off because then I can't stop looking at myself. That sounds so conceited. And I promise y'all that I am not conceited like that at all. I promise. All right. It says I'm in my third term at LPN school and I still have trouble finding my study route, especially through pharm. So here's the good thing about pharmacology. I like to call it the umbrella method, right? So you have different categories. We have different families. So respiratory, GI, cardio, right? So let's stick with cardio. List out all the medications, all the big medication that you need to know for cardiovascular system. So we have our ARBs, our ACE inhibitors, beta blockers, calcium channel blockers, DIG, diuretics, anticoags, and platelets, right? Nitroglycerin, right? And so then we understand, are they inotropic, chronotropic, or dronotropic, right? Do they relax the heart? Do they strengthen the heart? Do they increase blood pressure, lower the blood pressure? And then we got to think about the safety implications. We check vital signs. Do we look? Do we hold this medication if the vital sign is here? Do we give it if this vital sign is here? So that's how you have to think of it. Understand the suffixes. So, dipines. So calcium channel blockers, dipine. So dipping in the calcium channel plus verapamil or cardiazem. The other name for cardiazem is diltiazem, right? And with pharmacology as well, know your generic names, right? So Tylenol, acetaminophen, aspirin, acetylsalicylic acid, right? That's what aspirin is, right? So you have to know you need to know the general terms, okay? And it takes practice. Practice, practice, practice. I've been busy. EMS is relentless. I bet it is. It says, that's why I asked you. Yeah, there's Kevin. We love you. Samantha, I appreciate you. I think the fastest way I learn medication is by simulating application. Talk it, Bell. Simulated application how? Simulated applications that you brought it up. Shout out to all 40 y'all out here rocking. I'm going to hang out. I'm literally going to hang out for about another 20 minutes. No lie. I'm going to hang out for another 20 minutes. Not 20 minutes, 10 minutes. All right. Because Naz and the rest of y'all be holding me hostage. Okay. Naz, I told you not to let people hold me hostage. All right. I told you. All right. I modded you so you didn't let people do it to me, and they did it to me anyway. All right. But no, shout out to y'all. Hey, we do NCLEX questions over here every Monday, Wednesday, Friday. All right. Naz and Samantha are in the building. They are my mods. They are awesome. Naz, listen, if I didn't like you, I wouldn't pick on you. Okay. And I wouldn't have made you a mod either. So don't play with me. All right. Getting simulated patients, say studying cardiac meds, get a cardiac patient and then use the meds. I like that. I like that. I like that. So yeah, if you're in nursing school right now, I see what you're saying. If you're in nursing school right now as well, and you're going to clinicals, go find those patients that are having that are on cardiac meds. All right. Not everybody's on cardiac meds. So the best way for you to learn them is to apply them. All right. I like that. I didn't think about that, but yes, that's the best way. That's why clinicals is so important. And that's why the passing rate for NCLEX was very low during COVID, is because a lot of nursing students did not get that aspect. All right. And clinicals helps out a ton. It helps out a ton. I'm trying to tell you. Fair. I'm doing psych this semester. Psych. Hey, don't be up in there fighting people. All right. I can't do psych. Number one, things are too funny to me. Number two, I'm ready to fight and I can't be in there like that. Or with your instructor as well. And now you try to give meds. There you go. I like that. So for psych, number one, Naz, you look like you have long hair. First of all, that hair needs to be tied up. All right. That's what I would tell you, number one, because in psych, in any aspect, all right, you can become a target. All right. So you want to make sure your hair is tied up. All right. Because I have literally seen psych patients grab at other folks like that. And it's wild. All right. So you want to do that. Remember, psych is about good therapeutic. It's about, number one, it's about safety for you, the patient, and everyone else. Good therapeutic communication skills, meaning if you're talking to a patient, keep them talking using open-ended questions, right? And then those are the biggest things about psych, especially when you start answering psych questions. But the biggest thing when you were working in psych, like if you go to a clinical, like a psychiatric hospital, is safety, right? My first day in clinicals, there was a code green. A code green is a combative patient. And I was with the 13 to 17-year-old adolescent boys, right? And one kid got mad at another kid, punched him in the face multiple times, like a couple days prior. And then he wanted to go to a day room and some other stuff. And they wouldn't let him because they said that he would fight a kid and he can't go. So he lost that privilege. When I tell you, my dude lost his mind. He started pulling the phone, like reaching over the nurse's station, pulling the phone, ripped it out the wall, grabbed the jug of water, threw it all across the day room. Like it was crazy. I heard a code green happen. 10 seconds later, there's all these other people. This short little blonde came up in there, twirled her hair up, and was just like, I swear, I thought she put on brass knuckles and she was ready to fight this kid. And she was little. She probably had to be about 5 foot, maybe 4'11", and she was ready to fucking just throw some hands, right? And I'm just like, hey God, me again. Why? Like, why you do that to me? Like, for real, bro. Can we talk about this? And so next thing you know, all these people, there probably been like 10 people that came in, and you see this kid like trying to juke and jive and shit, right? And so when he found an opening, my dude bolted like down the wall, right? And then he ran towards the nurse's station, and the nurse's station is high, like up to your chest type of high. And my dude fucking leaped over that like an Olympic hurdler. Like, it was fucking crazy. He leaped over it like a hurdler, right? And then I was standing there and I was petrified. So at this moment, I see this dude coming at me slow-mo, right? And so in my mind, I'm just like, I could have been at a barbecue right now. Some stupid shit like that, right? And I'm standing still, and in my head, I'm just like, do I punch him? Because I know when they jump over, anytime somebody jumps over a nurse's station, you have the right to protect yourself. And so at this point, I had my fist balled, and then I thought to myself, well, I guess I'm about to get kicked out of nursing school because I'm about to punch this 15-year-old boy in his face. Next thing you know, I'm standing still, and he's like trying to juke me. He runs to one side, and there's a fire extinguisher on the wall. My dude like goes to the wall, and then rips that whole fucking thing out of the wall. Like, I mean, rips it out of the wall. I mean, falls on the floor. And in my mind, I'm just like, that could have been me. He almost did that to me. Like, why? Why am I here? Help, help. Right. And then next thing you know, it's just like, as soon as he like ripped it off the wall, there was like 4 dudes on him. And then they like funneled him into a room. And then in my mind, I'm just like, that could have been me, bro. That could have been me. And then the nurse came out and she was just like, so how do you like psych? And I'm just like, nah, bro, this ain't for me. This ain't for me. I'm only here for clinicals and you'll never see me again. So that's my story. Naz, so be ready to fight. Okay. You can't take your poodle there. All right. But make sure that these are good. No, don't be fighting people, but definitely protect yourself. It's all about safety for yourself, for the patient, and for others. Good open therapeutic communication skills. Okay. Oh God, I didn't mean to scare you. I'm just keeping it real. I had a patient threaten me in my psych rotation saying I was his lawyer, and the nurse was like, no, that's my paramedic. If you move at her, she will put you back to sleep. Nice. That's how you do that. That was clinicals. Yes, that was clinicals. Look, there was another dude in clinicals, and I was with this girl, and I think she was pregnant at the time. I'm not sure. But we were in like the acute psych patients where people had nervous breakdowns, psychosis, active psychosis, schizophrenia, you name it. I mean, wild. One dude was walking around like in a dazed state, just walking like back and forth. And then our instructor comes in there. She's like, yeah, go out on the floor and mingle. I was just like, you want me to risk other people's lives? I think not. Like, I'm going to stay right here. And then she's just like, no, go out there and start talking to them. And I'm like, all right, cool. So we're out there talking to them. Me, I'm just like, nah, I'm like, I don't need nobody walking up behind me. I don't need nothing crazy happening. And the next thing you know, dude walks up to us and he was just like, he looks to the white girl, because it's a white girl that's next to me. He points at her and he's like, you're racist. And I'm like, and I look at her and I'm just like, you're racist. And she's just like, no, I'm not racist. My husband is black. And he's like, no, he's not. And I'm like, I thought you said your husband was black. And she's like, oh my gosh, shut up. So not me agreeing with the dude. Not me agreeing with the dude who's not all there. And so then he started laughing and he was like, ha, ha. And then gave us like a daze. And I'm just like, all right, bro, we got to go. We got to go backwards. So that was my second time. That was my second time in psych. And I think what really did it for me was when I went to psych, well, we did our rotations and then they put me, it says, Kevin, we're taught not to do that. Listen, you see what, listen, this is why I can't be a psych nurse. You see how I turned that into comedy gold? Look, you don't want me there. You don't want me there. I don't want to be there. So don't put me there. Right. So, but then here was the kicker. They put me an adolescent female, 13 to 17. And let me tell you right now, I, as a man, have never felt so uncomfortable in my entire life. Like, truly, these young ladies had a lot going on. When I walk in there, the nurse, I had already known her from before. Her and I were talking, and then I'm sitting at the desk and I'm going through charts. And then next thing you know, they all start coming up and they start asking me for something. And then they were just like, hi, sir, can I have that? And I'm looking at her and I was like, hey, can I give them this? She's just like, yeah. And then another one's just like, hi, can I have this? And I'm like, yeah. Hi. And then I bullshit you not, within 15 minutes, like 20 of them were coming in and out. Like, where we're just like, can I have this? Can I have that? And then the nurse keeps seeing them. She's like, y'all stop coming up here asking him for stuff. And me being me, I'm like, why do they keep coming up here? And then she was just like, oh no, like they're coming up here to see what you look like. And I was just like, what does that even mean? And then she was just like, they're coming up here because they're interested in what you look like. And I was just like, I'm like, no. And so I'm just like, I start to get embarrassed. And then if I had rosy cheeks, you would be able to see them. And then I'm just like, and then I felt, what's the word? I felt emasculated. I was just like, I'm uncomfortable. So I was kind of like doing one of these numbers. Like, and then I went to go sit under a shower and I went to go cry because what they did to me, right? No, but seriously, like, listen, I'm telling you right now, like I really like I read a lot of their charts and it was crazy. Like it's crazy the things that have happened to these young girls. But then like that moment I was just like, I don't want to go in there no more. Like I felt like I was a piece of meat thrown in to a lion, like a lioness's den. And nah, I'm good. I'm good. It's okay, Tink Tink. Listen. Mm-mm. No. No, 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 no. And then next thing you know, you start to see them like fight with one another. Like you see one who is like the ringleader saying like, yeah, fuck her. She's the one who did it. And then you hear the other one say like, they're like, yeah. And then you see them gang up on her. I'm like, yo, what is happening? See, see, see? That's like lioness female instinct. Like y'all just like up prey. There it is. And y'all started prey on your own. It was terrible to see. It was wild. No, but Naz, that was my psych experience. That was my psych experience. I saw another kid run out of the day room and try to escape, and he made it to the fence. Yo, he made it to the fence. And then he was trying to scale the fence. And I'm like, I witnessed this happen. And I was just, I watched the little kid run out and run towards the fence. And then I'm just like, look at that little kid run. And me just so nonchalant about it. Our instructor was just like, go after him. I'm like, go after him? I don't know what that kid got on him. And he made it to the fence. And then you see the other people like go after him. Like that shit was wild. Psych was crazy. And I'm thinking about it now. That happened so long ago. But I'm thinking about it now and it was just really funny. It was funny. I can laugh about it, even though those moments are so serious. But but you got to be ready. You got to be ready for psych, though. You got to be, because psych is kind of like, I've never been to jail. I've never been to prison or anything like that. But I can only imagine you got to be ready because you don't know what's going to happen. You can get a combative patient like that. And then the safety of everybody starts to, it could go crazy like real fast. It's kind of like a code. Like next thing you know, patient's good and talking to you. Next thing you know, code blue and you're traumatized for the rest of your life. It happens. It happens. All right. Can't turn your back. You really can't. You really can't turn your back. All right. And you always have to be ready. But mental health, listen, mental health is a very, very big thing. It's a very big thing across all facets of a mental health physician, mental health nurse practitioner, mental health nurses, all that stuff. Mental health aspects in the military is very, very big. It's a very needed area. It's a very needed area. When it comes to, taking care of people. We all have our own issues. We all have our own sets of trauma. Like we really, truly do. And you really have to think about it on the mental health side. The aspect is like, not everybody's trauma. My trauma doesn't equate to your trauma. I'm not going to come over here and be like, oh, well, guess what? This happened to me, so that was worse. Like I would never do that. And those people really did have some type of trauma that was going on. And so we as nurses have to be able to understand that, right? We have, and we can't judge. Judgment happens, but we can't judge people on those aspects because trauma is related differently to other people, right? It says, love the good old sir, exactly. Exactly, right? So, but all right, I appreciate you guys listening to my rant. If you guys don't follow me, I do NCLEX questions every Monday, Wednesday, Friday at 5:30. I have an NCLEX course. I have a book coming out. I have an ebook to help you with NCLEX. All those things are linked in my bio. Make sure you guys go over there and check me out on YouTube and on Instagram because we don't know what's going to happen to the good old ticks of talk, right? You know what I'm saying? Like I'm here for y'all. I do my thing. Red's in the building. I see you. All right. So if you guys don't have any other questions, I'm going to go ahead and I'm going to bounce off. But the one thing I always say before I get off, make sure you take care of yourself. You graduated. Shout out to you for graduation. I'm super proud of you. I know you're going to come out here and do great things. So we already know the last thing that we got to do. All right. The last thing that we got to do is that we got to get past that NCLEX. We got to get past that NCLEX. We need that license. All right. You too. Bye. Yes, you guys have a good weekend. You guys have a good, safe weekend. Hey, make sure you take care of yourself. This is where the mental health aspect. Take care of yourself mentally because if you don't take care of you, you are no good to no one. All right. Not no kids, not no patient, not no husband, not no wife, not no whatever. All right. So take care of yourself mentally, always, first and foremost, because if you don't, you are no good to nobody, to include yourself. You first. All right. So you can take care of other people. Because that's what we do. All right. So I hope everybody has a really good weekend. Happy Mother's Day. to all of those mothers that are out there. All right. Hope you guys have a safe one. And I will see everybody on Monday.